This audio overview is generated using AI for educational purposes by Carey Family Dental and does not replace a consultation with your dentist. Um, have you ever slept for like 8 straight hours but still woken up feeling completely exhausted?
Right, reaching for that second or third cup of coffee before noon.
Exactly. So today, our mission on this deep dive is unpacking airway dysfunction and sleep disorder grieving, or AD and SDB in adults.
And at the baseline, we're really talking about a state where you are physically failing to pull in enough air during the day and, well, especially at night.
Yeah, and it often flies completely under the radar, silently causing irreversible damage.
The sneaky part is that the warning signs rarely look like someone dramatically gasping for air. Instead, they disguise themselves as, ordinary daily annoyances.
Okay, let's unpack this because the red flags are honestly bizarre. I mean, I am not just talking about snoring here.
No, definitely not just snoring.
Right, we are talking about heavy caffeine dependency, waking up constantly in the middle of the night to use the bathroom, chapped lips, dry mouth, morning headaches, and even heartburn.
Yeah, it is a lot of things people just brush off as normal.
It is like your smartphone battery dying by 2 p.m. because a hidden background app is quietly draining all your power. You think you are just stressed or getting older, but your body is secretly fighting a war for oxygen all night.
What's fascinating here is the sheer mechanics behind those random quirks. Take teeth grinding, for example.
Right, a lot of people think that is just from stress.
Exactly. Your brain isn't just grinding your teeth because you had a stressful day at work. When your airway collapses during sleep, your brain panics and forces your jaw muscles to clench and push forward.
Wait, so it is literally trying to pry the airway open mechanically?
Precisely. It is a physical survival reflex. And that heartburn you mentioned, when you struggle to inhale against a blocked airway, it creates a negative pressure vacuum in your chest.
Oh, wow, really?
Yeah, that vacuum is so strong it actually sucks stomach acid up into your esophagus while you sleep.
That is wild. I mean, it makes so much sense when you explain the physics of it, but what is actually creating the block in the first place?
Well, we know inflammation from allergies or poor nutrition plays a role, but there are also structural blockages.
Right, things like an open mouth posture, enlarged tonsils, a deviated septum, or tongue and lip ties.
Yeah.
But I have to ask, how does something seemingly minor, like a tongue tie, choke off your air?
So think about where your tongue is supposed to rest. Naturally, it should suction to the roof of your mouth. A tongue tie physically tethers the tongue to the floor of the mouth.
So it sits too low.
Right. And when you lie down to sleep, gravity takes over. That low resting tongue just falls straight back into your throat, completely blocking the pipe.
So what does this all mean? How does something like breathing through your mouth escalate to heart attacks, strokes, weight gain, type 2 diabetes, and even depression and ADHD?
Because you are putting your body into a chronic state of physiological terror. When that tongue falls back, your oxygen levels.
And the brain just freaks out.
Exactly. Your brain senses you are suffocating and slams the panic button. It throws your entire nervous system into a fight or flight response.
Wow.
Doing that dozens of times a night bathes your system in stress hormones like cortisol. Over years, that constant adrenaline spikes your blood pressure and wrecks your metabolic regulation.
Which drives up that diabetes and weight gain risk.
Right, and it severely impairs your brain's ability to regulate mood and focus.
Okay, with the stakes being that high, how do we spot this and fix it? For screening, aside from sleep questionnaires and airway assessments, there is a tool called high-resolution pulse oximetry, or HRPO.
Yeah, HRPO.
That is more intense than just that little clip they put on your finger at the doctor's office, right?
Considerably more. HRPO continuously tracks microscopic, second-by-second, drops in your blood oxygen while you sleep. It reveals exactly when and how often your brain is hitting that panic button.
That is incredible. And once we map that out, we can intervene.
Yes, and the solutions really fall into a few categories.
Right, and those interventions aren't just limited to a CPAP machine. The non-surgical route focuses heavily on sleep hygiene. A cool, dark room with zero blue light, no pets in bed.
Plus nasal or myofunctional therapy.
Yeah, I had to look that one up. It is basically physical therapy for your face and mouth, right? Retraining the tongue to sit where it belongs so it stays out of the airway.
That is a perfect way to describe it. Alongside oral sleep appliances that hold the jaw in place, those exercises can drastically reshape how you breathe.
But I imagine sometimes structural problems require structural fixes.
Absolutely. That is where surgical and orthodontic options come.
Like using orthodontics to physically widen the palate and open the airway? Or jaw or ENT surgeries?
Right, like removing tonsils or even just surgically correcting a tongue tie to release the tension.
Right, which just clears the whole path.
Exactly. If we connect this to the bigger picture, fixing airway dysfunction and sleep-disordered breathing isn't just about stopping a snoring habit so your partner can sleep.
Right, it is so much deeper than that.
It is about restoring the absolute ultimate foundation of human health, which is oxygen. Without a steady supply of it, every other system in your body is running on fumes.
It really leaves you with a profound question to ponder. If our breathing mechanics can literally dictate our mental health, our weight, and the strength of our heart, how much of modern society's chronic fatigue, anxiety, and stress is actually just an unrecognized airway problem?